Testing, testing, 1, 2, 3. Seeing if this works. Hello, my name is Christina Chaikin, and I am a dentist from Chicago. I was born and raised in this beautiful city. I did my undergrad at U of I down in Urbana-Champaign, and I did my DMD at UIC College of Dentistry. As a clinician, my primary values are, I call them the 3 C's: comprehensive, competent, and compassionate care to give our utmost best for our patients. I currently practice at Bridgeport Smiles, which is part of a large DSO. And some other things I do all my own hygiene. I love hygiene. I do fixed, removable, selective molar endo, surgical extractions. I do P's. I work with ortho. And a growing area of interest for me is implants, which I'm currently taking a Hyoscine course with Dr. Marcus Lastimado that will conclude in August of 2022. Alright, now for some fun stuff. Here are my hobbies. Number 1, I consider myself a certified book nerd. I am an avid reader. I love collecting old books, and here are some of the things I found. Number 1, I found Netter's once at a vintage bookstore. It's like the Bible of dental anatomy. I found this nice book of Crown and Bridge prosthesis. I think it's so funny. In the foreword, one of the sentences talk about how dentists combine the biological science knowledge of a doctor, the structural design ability of an engineer, and the aesthetic eye of an artist. And I was like, oh my goodness, tell me you didn't put that in your personal statement. Was it just me? Did we all think of that? Anyway, the next thing I have here is, yes, this periodontics for the dental practitioner. I love perio because I consider it to be the foundation of oral health. I love doing hygiene because it is so important, and gum health is so underrated. And this one, finally, wish I had this when I was a student. It's an atlas of human histology with hand drawings that are so detailed and so wonderful, but like so simplified. Imagine this to study off of. Make sense of some of those crazy histology slides. Anyway, and next, I also love food and drink. I love trying new cafes and restaurants. And for fun, I want to show you how to make my signature drink. It's called the Gingervitis. It's basically a take on a gin and tonic with a touch of ginger syrup, which gives it its signature name, and a dash of grenadine, which gives it that signature erythematous appearance. I don't know if it's a clever and a little bit unappetizing, but I was very amused with myself after thinking of this. Ta-da! And for the final component of the hobby portion, I love music. I love collecting records, I love karaoke, and all things and all sorts, and I dabble in the keyboard and guitar. Alright, and the last segment of this video is what draws me to dentology in particular, and I will expound on this from a video of myself on my lunch break, discussing exactly what that entails. The first thing that draws me, it appears to be very doctor-owned and operated. Coming from a DSO, I have seen firsthand how treatment falters, and ultimately the patients suffer when people that don't do clinic make clinical decisions. There's some things that look like it makes sense on paper, but it's ultimately the provider that sees that, you know, there's only limitations, physical limitations of what we can do. So I am excited to see what happens when someone who is first and foremost a clinician runs an office and makes those decisions. Number 2, I have heard that it seems like it's a very intentional process on who you choose in your office, and I respect that because I have seen, at the end of the day, dental, we all have the same resume, same skills, you know, and everything we do in an office has to be learned in office because every office does things differently. And it just seems that there's a pattern of treating people as expendable and just filling a spot with whoever's available. And what happens is, yeah, on paper they might have, you know, experience, front of house experience, back house experience, but you don't see, is this person a team player? Does this person care for the greater good? Are they gonna function as a whole, you know, as a part of a whole and a bigger goal here, or are they only gonna be out for themselves? And those are the things that I'm drawn to about dentology, to be candid, because those are two of my biggest gripes coming from a DSO context and having these frustrations. So those are the main factors.